Hi, everybody. Bonnie is going to introduce Megan Quimby, and she's our guest speaker today on our PCA Lecture Series. Megan, thank you so much for being with us. Megan will speak for about 45 minutes, and then we're going to take questions and hit her with whatever we can hit her about word finding problems and other cognitive issues. Bonnie?
Thanks, Jamie. Welcome, everyone. It's a real pleasure to have Megan Quimby with us. She is the director of the Speech and Language Pathology Program in the Frontotemporal Disorders Unit, MS General Hospital in Boston. She has been working with patients with various types of aphasia, primary progressive aphasia, as well as patients who have language disorders related to neurodegenerative diseases. And we're really lucky to have her joining us today to talk about the different strategies that she typically works on with patients. She's also heavily involved in research looking at specific speech language pathology. So we're really lucky to have her with us today. Megan, thank you again for taking the time out to join us. And I'm going to just let you take it away.
Thank you, Bonnie, and thanks for having me here today. I'll just share my screen with the presentation. Does that look good, Bonnie? Can you see that and everyone? Okay, great. As Bonnie said, I'm the director of the Speech and Language Program at the MGH FTD unit. I mainly work with individuals with primary progressive aphasia, which is a neurodegenerative disorder that mostly affects speech and language. However, today I'll be using some of those tools because we also do speech and language therapy with individuals with PCA. I know that some individuals have difficulty with word finding or maybe reading or writing. And then I'd love to hear any questions that I don't get to in this presentation, and I can answer those as best as I can. Again, thanks for having me here today. So just in terms of what I'll be talking about is I'll briefly talk about what we do in terms of a speech and language evaluation, those with different types of neurodegenerative disorders such as PCA, and then I'll talk more about therapeutic approaches in speech language therapy, as well as something called cognitive rehabilitation therapy that some of you may have some familiarity with. So we definitely take an interdisciplinary approach in our lab and in our clinic. I don't know how many of you have had any interaction with a speech language pathologist, but it is sometimes recommended depending on if you have any difficulty with communication. Of course, you see neuropsychologists and physicians and maybe social workers, but it's not known always that speech language pathologists can be helpful in certain situations as well when it involves communication difficulties. So many of you may know the difference between speech and language. Honestly, I didn't really know before I went to graduate school for speech language pathology, but just in case, because I'll be referring to these terms throughout the presentation. So speech is the physical production of the sounds of a language through articulators, whereas language is the actual expression or understanding of thoughts, ideas, and concepts using a shared symbol system. So speech is just one way of getting language out. You can also use writing, you can use sign language, but speech is just one of the physical ways of getting your ideas or your language out. And when we do a speech and language evaluation with all different types of diagnoses, we look at both speech and language. So expressive and receptive language. So for instance, how well you speak, how well you understand language. And we look at all different areas, such as how fluent are you when you speak? How is your word retrieval? Can you come up with the words that you want to say when you're communicating with someone? How well do you understand them? How is your reading? How is your writing? How is your functional communication, which basically means like, how well can you get your message across, even if it's maybe not through speech? How well can you express your needs and your wants and your thoughts? And then during this evaluation, we do a bunch of different testing, somewhat like a neuropsychological exam, but we focus on speech and language. But we also interview the patient to see how their communication is in daily life, as well as family members and loved ones to see what's their perspective about how communication is going in daily life. And then we're continuing to do these assessments during COVID-19. We're just doing them on the computer. So basically, just like this presentation where the clinician will, administer the tasks on a computer, and then the patient will respond to the tasks and the questions through Zoom and a PowerPoint discussion presentation. And then we use these for clinic and research. So we have a clinic that maybe some of you are familiar with, and the memory disorders clinic, which gives either a diagnosis or confirms a diagnosis and monitors people with PCA and other diagnoses, as well as have research studies in our FTD lab, again with monitoring symptoms and hopefully giving support and treatment to people with a variety of diagnoses. Okay, oh, sorry, I just want to make sure. Okay, so for treatment of neurodegenerative diagnoses, it's very different than, for instance, if you have difficulty with communication from a stroke. With a stroke, you may focus on rehabilitation, so getting the communication or the words to be better. However, in neurodegenerative disorders, a lot of the time the focus is on compensatory strategies, because the symptoms, unfortunately, will likely get worse over time. We like to teach compensatory strategies to get around the speech or language impairment. So for instance, if you're having difficulty finding words or coming up with the right word, rather than trying to, for instance, memorize word lists of words that you have difficulty naming, it may make more sense to find strategies to work around those words and prevent things like anxiety or frustration, and rather get your message across in a different way, maybe not using that specific word, but still getting your message across. And it's also important that the treatment is very personalized. So, like people may have different difficulties in their communication depending on their situation. For instance, you may have difficulty reading, or you may have difficulty with word finding. So of course you don't want to treat the wrong thing. And then depending on your living environment or who you're around or what's important to you, what your goals are, it's really important that the clinician knows to personalize the treatment. Support groups are really important. So people with difficulty with the diagnosis don't feel alone. So I'm really glad to hear that there's this, group that has people to talk to realize, like, even though these are, rare diagnoses, that you're not alone, and you can talk to people about what they have difficulty with, what helps them. Community resources as well is really important. Having resources near you that you can, find support is really important. And then for treatment, like I said, the goal is functional communication. So getting your communication to be as best as possible to get to express your needs and wants, and participation in daily activities. So independence and participation in daily activities. And that has more to do with cognitive rehabilitation treatment, which I'll get to later in the presentation. And then in terms of the treatment goals for speech language therapy, In neurodegenerative disorders, the patient's symptoms and severity matter. So like I was saying before, it depends what the symptoms are. We want to treat those specific symptoms, and severity matters also because, we also want to treat the symptoms in the severity they're at. We recommend treatment to be in the mild stages or mild to moderate stages. When it gets to in the more severe stages, it's more about talking with the caregiver and the patient about how to compensate for difficulties that might be outside of communication. And we need to make sure that the goals are functional, achievable, and realistic. We don't want to pretend like we have a cure for this disorder or make the people feel that, they're gonna, have perfect communication after the treatment. But we can help, and we just want to make sure that, it's realistic in the treatment goals. Communication goals usually revolve around making sure that the patient or the person with the diagnosis can express their feelings and needs. And in terms of memory and executive functioning goals, is usually to promote independence in their daily lives. And to get into a little bit more detail about what speech and language therapy looks like, we focus again on compensatory strategies. So most of you probably don't need any type of assistive technology. That's more for people with primary progressive aphasia, where they have a lot of difficulty speaking, a lot of difficulty with articulating sounds, but sometimes communication notebooks can be helpful with pictures and, different personalized pictures that someone would want to communicate about, and they can point to them instead of, saying the actual words. Drawing, gestures, and writing can be very helpful, especially if you can't come up with a word or a specific word. Just any way to express that word without actually saying it. Structured yes and no, yes/no questions are more about communication partners using yes/no questions when the person with the diagnosis has a lot of difficulty with word finding. So instead of asking an open-ended question that may require a lot of word finding, opportunities, it's better to for the communication partner to really take that on and say, do you want X, Y, and Z? Yes or no? And so the pressure isn't on the person who has the difficulty with the word finding. PAL is a strategy for word finding as well. I'll get a little more into that in the next slide, but what we try to get people with a diagnosis to do when they have word finding difficulty is to talk around the word instead of trying to get at that very specific word that might increase anxiety and frustration and lower the chance of you actually getting at that specific word. So thinking about like describing the purpose of the word, the appearance, or where it's located, the communication partner could still get at what you're talking about. It may require more words and more time, but you still can get your message across by using that strategy. Environmental modification strategies are really important. Bonnie may have talked about this at one point, but reducing internal and external distractions during communication is really important. External distractions being things like things you see, things you hear, things you smell. So if you're focusing on something you're seeing or something you're hearing instead of attending to the conversation, that's going to make it a lot harder to focus on the actual communication. Internal distractions being things like worrying, anxiety, sadness, and those things are very real, but there are strategies to identify those internal distractions and try to eliminate them as much as possible, so that way you can focus on communication when you're having a difficult time doing it. This is probably obvious, but face-to-face interactions are really important. Everyone's busy these days, and you could be screaming down the stairs and communicating, but of course that's going to make the conversation a lot more difficult if you can't see a person's face and facial expressions and gestures and things like that when communicating. So these are all types of compensatory strategies that you can use to make communication a little bit more easy. There is something called impairment focused treatment. So an example of this is something called semantic feature analysis. So if a person has difficulty with word finding, instead of talking around a word in a compensatory way, there is this semantic feature analysis allows you to try to remember more of the words that you're forgetting by thinking about, what category they're in, just different semantic properties of the word and using it in example sentences and writing the word down. And research has shown that in the mild stages of a diagnosis that this can actually help with remembering words that you're forgetting. But again, this is only used in very mild or mild stages. And in the long run, I really promote focusing on compensatory strategies because those are strategies that can really work long-term and help with your communication difficulties. And sorry, that's a lot of information in one slide, but of course, I'm happy to answer questions with anything that comes up after the presentation. And so I briefly mentioned PAL, so purpose, appearance, location as a compensatory strategy for word finding. So this is a really simple example. So let's say that someone is having a difficult time remembering the word apple. They just can't think of the word apple. Of course, it's usually more like lower frequency words that people have difficulty, but this is just an example to show how you would do it. So a person can't think of the word apple. So instead of staying there and being like, oh, I can't think of the word apple, I don't know what to do, I really can't get at it, and they're kind of being a communication breakdown, and then both the communication partner and the person who's having difficulty is just like, oh, okay, let's just like end the conversation because we can't figure out what we're trying to talk about. You purposely talk around the word. So you think about what's the purpose of this item. So it's something I eat. What does it look like? It's red and round. And where is it located? Maybe in a market, or it grows on trees. And then my best bet is that someone will be like, oh, you're talking about an apple. And then you can move on with the conversation instead of ending it. Yes, it will take longer. People have to be patient. But again, at least you can continue with the conversation. And then semantic feature analysis, I talked about just now too, but this is just the way that it's kind of done to, again, not talk around the word, but remember some of the words that you're having difficulty using. And then some of these may be kind of obvious, but when you're in a situation, when you're having difficulty communicating, they can slip your mind sometimes. So it's really important, in order to support communication, to be patient, allow extra time to communicate. So obviously do not try to have a conversation when you're rushed. Create an environment and a situation where there is extra time to communicate. And then sometimes conversational partners or communication partners they just inherently speak louder when there's someone who has difficulty with communication. And just keep in mind, it's not usually due to a hearing loss, it's an actual speech or language impairment. So speaking louder might, not do what you want it to do. Try not to interrupt the person when they're speaking and trying to communicate. A big one that I see with caregivers and family members sometimes is that they want to test their partner to see what words they do and do not know. I really try to promote not doing this and just helping when the person is asking for help. So if the person is like, that word, like, and they're describing a word, or like, the word because you just know them well enough to know what they're talking about, help them instead of being like, you can get it, like, I know you have this kind of thing, because it's just going to add to the frustration. And honestly, testing them is not going to allow them to get the word more likely the next time. So just help when it's requested. But if a person who is having difficulty communicating is not asking for help, then don't help them. Maybe they want just a moment to try to get it at themselves. Like a big thing that we do in speech language therapy is just working with the caregiver and the individual with diagnoses and figuring out what's the best way for the person to communicate that they do or do not want help. Maybe it's something as easy like, this means no, I just need a moment to, get the word I'm trying to find, or like, yes, please help me. Like, I don't want to, like frustrate myself, and let's continue this conversation with a little bit of help. And then again, I already mentioned how important face-to-face communication is. And ways to support comprehension. Again, these might be obvious, but use short, simple sentences. If someone has difficulty with comprehension, obviously using short, not grammatically complex sentences can be helpful, reducing rate of speech. And then stating the topic in the beginning of the conversation instead of the person trying to figure out what the topic is based on some details is helpful. Rephrasing and reviewing messages when it's necessary can be helpful. Try saying it a different way if it was difficult to comprehend the first time. And then for people with difficulty with comprehension, be honest and ask for clarification when you don't understand, so then it doesn't get more complex and you get more lost after the conversation has gone along. And then again, the goal of speech language therapy and neurodegenerative disorders such as PPA is improving functional communication. So getting the message across in the best way possible. It doesn't have to be in the perfect way and like the shortest amount of words. Just, maybe it's in writing, maybe it's in gestures, maybe it's in, maybe it is in speech, but just figuring out like using the person's strengths to get the message across. And then speech and language therapy may be helpful in the beginning. I usually recommend 5 to 10 sessions, but then as the course of the disease changes, coming back, and because the strategies may need to be changed or modified in a little different way because the symptoms are a little bit different. It's very important to have this type of treatment with an experienced speech language pathologist. In neurodegenerative disorders, most speech language pathologists are trained to work with individuals who have language impairment due to a stroke. And again, that focuses on rehabilitation rather than compensatory strategies. So if you don't have this treatment with an experienced speech pathologist, you may get the wrong type of treatment and you may feel like you're wasting your time and that the treatment's not helpful. So, a referral or someone who has an experience in these types of disorders is really helpful. It's good to practice the strategies that you learn at home. So that way, if they're working or they're not working. You're not going to hurt anyone's feelings, but you need to be honest, this is not helping, the strategy is not helping. And so the clinician knows how to modify it. And then again, practice it at home to see if it's working or not working. And I usually recommend the caregiver to be there too, because it's not just the person with the diagnosis who has to modify how they're communicating. It's also the caregiver or the conversational partner or communication partner who has to modify how they're communicating to really promote easier communication with the person with the diagnosis. And then there may be people here who don't have difficulty with memory or executive functioning, but sometimes, there is impairment or difficulty in these areas. And a lot of people don't realize that speech language pathologists do something called cognitive rehabilitation therapy. So instead of focusing on speech and language, they focus on difficulties in memory and executive functioning. So, planning a task and executing a task. And the things that they go over are things like creating a structured routine and schedule. That way you don't have to rely so much on your memory to know what you're supposed to do in the day, but really creating a routine just makes those things more automatic, and a schedule makes things more automatic. And memory aids can be helpful with this too, like a whiteboard, for instance, reminding you that you have to do this thing at that time, or, an alarm or a watch, or, there are simple and more advanced technological memory aids. But again, you're not relying on your memory to follow a plan to do certain tasks. Speech pathologists can also help with prioritizing. Again, it's important that the treatment is personalized, so you can bring in your own to-do list that you need to do, and then the speech pathologist can help you prioritize what is important to do first, what's important to do last, how long things will take to do. So then the load is more off you, and you're just like, have a plan, like, okay, this makes sense on how to prioritize this long list of tasks that you need to complete. Breaking down tasks is really important. Like if you have a really large task, like, I don't know, like cleaning out the house before you move, it's really hard to not procrastinate or feel overwhelmed by such a large task. Instead, if you break these into simpler steps and then have, deadlines when you want to, like clean the shoes in the closet or clean out the shoes in the closet, and break them into smaller tasks, they're more doable, and it really promotes allowing to get those bigger tasks done by breaking them down. Addressing components of memory can be really important. A lot of people don't realize that you have to attend to what you're trying to remember before you remember it. If you don't attend to it, you're never going to remember it. You're never going to encode or store the information or retrieve it later because you never attended to it. So for instance, if you're parking your car in a big parking lot and you want to remember where you parked it, if you never look at where you're parked, you have no chance of remembering where it's parked. And reducing internal and external distractions is important in communication, but it's also important in trying to remember things. Again, because you're not going to attend to things if you're distracted. So really trying to realize what these distractions are and eliminate them as much as possible when you're trying to remember something or communicate is really important. And then support and resources. So education about the diagnosis is really important. That way, when like what is to come, and like what are the reasons why you're having these difficulties. What can family members and loved ones do to help? So it's really important to have an interdisciplinary team and health professionals to educate you about the diagnosis, so you know what is to come and why you're having these difficulties. Shared goals between the patient and caregiver are really important. This might not be very important in terms of PCA, but creating a safe environment, actually, like for instance, if you're having difficulty seeing certain obstacles in your home, or where you happen to go often, like creating a safe and as safe as possible environment in your home and places that you often go to is really important. That can be even discussed with a speech language pathologist or other health professionals. Reducing caregiver burden is really important. So support groups, I already talked about that. There are a bunch of community events I know, such as this one, I suppose. And then we have a bunch in our lab. We have an MGH FTD YouTube channel where it has all different topics and presentations on different topics. And then adult day health programs can be helpful in creating a routine. And there's a bunch of different community events and support and resources that I could talk a lot about, but and yeah, I think that's everything. And then if anyone has any questions, I'm happy to answer them. Yeah, I know I didn't get to everything, but happy to, again, answer any questions. Thank you.
Thanks, Megan. That was a very helpful, chock full of information talk. We really appreciate it. I'm going to start off the questions if that's all right, just because I think it might be helpful if you wouldn't mind walking us through an exercise with a semantic feature analysis technique, for example, that you discussed, just so people can get a sense for what that might look like if they're working with a therapist, or if it's something that they could even start trying on their own at home with their family members, care partners. Would it be possible for you to walk us through a semantic feature analysis exercise?
Yeah, so one of the most important things with semantic feature analysis is to think about the words that you're having difficulty with. So that could be like for like a certain percentage of the time, I can't remember this word. So it's important that you have difficulty with the word, as well as that it's a personalized words that you use often. So you don't want to bother spending so much time trying to remember words that aren't personalized to you, that you don't really use ever. So like, let's say you have a hobby like golf, and you can't remember some of the words that are used during golf, like a club. I don't know why I use the example golf, because I don't know much about golf, but like there are certain words that you can't remember because you go golfing, a certain amount of time every week. Like those are good words to use because you know you're going to use them often, and you know that you can't remember them a lot of times when you try. So you come up with a list of words. It can't be that many. So like you would probably start out with something like, let's say between 15 and 20 words. You're not going to try to remember 100 words, because it's not going to work very well. So then you think about semantic attributes of the word. So what category are they in? How do you use it? What does it look like? Where is it found? Just different attributes. And then you write the word maybe a few times, you say the word out loud a few times, you use it in a sentence, then you might think of a different sentence the next week to use it in. And by doing this process and practicing the same personalized words each week, and you practice it at home too. There's different ways to have homework to practice these words. Research has shown that you actually remember those words more often than if you didn't do this process. It is a pretty extensive process, but it has been shown to work.
Megan,
And
thank you.
fun.
Could you just take your screen off so
Yeah.
you can do when you're talking? Thank you.
Yeah. Let me go out of the presentation mode.
Thank you.
And then 1 second, I just need to find.
And while you're doing that, I'm going to add, because people with PCA have problems. There are several of us who have problems with word finding, but in PPA, there are so many different variants of, understanding what an object does, and so it's not just word finding. It's understanding what the word does or what the word means, how to use the word, pronouns, all these different things. Do you think that as the disease spreads, these different types of problems would happen in PCA? And Bonnie, you can address this also.
Yeah, I don't know if you would answer it differently, Bonnie, but I wouldn't expect, for instance, as the disease progresses, for it to look, for instance, more like a PPA, a primary progressive aphasia, where, communication would be the primary difficulty. I would expect, like, if a person has difficulty with word finding, for instance, for it to potentially get worse over time. But I wouldn't necessarily expect other areas of language to be affected necessarily.
Okay, thank you. Bonnie, do you have anything to add?
Yeah, I would agree with Megan, and I feel as though, as everybody on this meeting knows, PCA is such a mixed group of symptoms, and which symptoms are the first to appear and how the progression proceeds is really highly variable. So some patients may tend to have more involvement as the disease progresses of the language areas, in which case you might start to see more of the aphasia and the aphasia subtypes that Megan was describing and she sees in PPA. So I think it's a very difficult condition to try to describe how the language problems will start to appear over the course of the disease. Some people you see having much more language difficulty, which is not typical of PCA, and may end up being diagnosed with a form of aphasia.
Okay, good. Let's take some questions. If anybody has a question, you can either unmute yourself or raise your hand and I will unmute you. Come on, no questions.
Carmel, I have a question.
Thank you, Carmel.
I find often that I have a word in my mind, but then when it comes to saying it, I only get the last part of it. I mean, the first part of it, and I don't get the word out.
Or she gets a jumbling of the syllables, so it might be even a similar word that isn't quite the word she's going after. I don't know if that's what you mean.
Well, anyways, I know the word and I just can't get it out, and then it doesn't even get close to it. It's like the last part of it is gone, and so it makes no sense. Anyway, that's the best I can say about it. The most I can say.
Yeah, so you're not alone in that at all. Like I hear that honestly every day of my work is that someone knows what they want to say, but they can't get the word out. So that you're definitely not alone in that. And in those circumstances, there are strategies that I would suggest. For instance, it might be as simple as if you don't have difficulty writing, just having a pad near you and writing the word out for those specific circumstances, not for all words, just the ones that you're having difficulty with. If your partner knows what the word is, then, he can just say it and say, oh, is this what you mean? Or if none of those strategies are working, you can talk around the word and try to, figure out a different way of getting that word across.
That's usually the way.
All the time.
That's usually
Yeah.
the way. I think
The yell thing with the
I think
Yeah,
one of
which is what we try to promote, which can be really frustrating and annoying and not efficient, but it might be the most efficient way of actually getting your message across, unfortunately.
yeah, and unfortunately with PCA, the writing and the drawing is problem too. So that becomes
or at least for most
at least on those. I mean, there's a good list of strategies. That one's a little harder because of it, but I think the structured questioning is good. I think there's a balance between help, like you said, when to help try to guess what she means versus interrupting what she's trying to get out.
Right.
I had a kind of related question on there's expressing what she's trying to mean and comprehension. Are those fairly distinct? Like, obviously, are those fairly distinct things as far as when they have problems? Like, it's one thing if she's having trouble expressing it. It's another thing if she has a difficulty comprehending, what I'm trying to ask of her.
Right. Usually I would say those are separate things. Like I definitely have worked with people who have only difficulty with their expressive language, but have no difficulty comprehending language. And that's when something like a speech language evaluation or neuropsych testing can be helpful, because we can really get at, is there any difficulty comprehending, or is that completely fine? Because you don't want to be in a situation where you think the person has difficulty comprehending, but they don't, because that can lead to frustration, or the other way around, where you think they're totally fine comprehending, but they're actually not. And then you think
Right.
they're understanding a lot more than they are. But yeah, they don't necessarily go hand in hand. You can have one or the other, an impairment in one or the other.
Okay. And then one last question, then do you have lists of people that you mentioned having neurological expertise in this rather than stroke? do you know, because we're scattered all over the country, like, are there
Mm-hmm.
lists of people that have that specialty we're in New Jersey, there's people in Colorado and Texas. Do you
Yeah.
know if there's a good source for finding?
Yeah,
that?
so that's actually similar to a question that was in the chat about, finding a clinician that specializes in these diagnoses. So the way we do it is, I have a list of, for instance, a lot of people in Massachusetts that I have referred people to that I know have experience with these diagnoses. And I have some out of state, but it's unlikely that I'll know of people that are, in that specific area in Colorado or wherever it is. So what I would recommend doing, if it's not in Massachusetts, is when you call the department and you specifically ask, what experience do you have with PCA, for instance? And if they don't have experience, you don't necessarily not go to them, but if they don't have experience, I would highly recommend that the neurologist or the team of health professionals that you work with give treatment recommendations to the clinician on how, or, just education about the diagnosis. That's really important. But if you can get a referral, that's obviously the best way to do it. But if not, just kind of doing your homework and being like, do you have experience with this? And if you don't, would you be up for learning about the diagnosis and how to treat it?
Great. Okay, thank you.
And I would think that most neurologists are familiar, especially if they work with PPA or PCA, they're familiar with language specialists, I think.
Yeah, I would say a lot of the time they do, but not all the time, especially if there's, like, for instance, on our clinic team, there happen to be speech pathologists on it. So they of course know who to refer patients to in Massachusetts. But yeah, I think you're right. Some of the time the neurologist will definitely have resources and know of clinicians to refer to.
Great. Any other questions?
I have a question.
Okay.
Can you hear? I'm Karen. I'm clear out here in Seattle. And so there's somewhat of a dearth, I guess is the word, of people that seem to know very much about PCA here. And so there's one thing. And I find with word finding, is it common? I'll have the words I have difficulty with kind of switch around. It's not just one. Up to this point, I couldn't make a list of 15 words that I'm having difficulty with. But what's kind of interesting is we just got back from a vacation. We're lucky enough to go to Southern California. And so I've been trying to, people will ask, well, but we were in a little town, kind of an obscure town. And people would say, well, where is this place? And for the life of me, it's outside of San Diego, it's outside of Palm Springs. But when I have gone to describe it, it's like, even though I was there, we talked about it, how often do you use the word Palm Springs? It's not a common word, but I could not describe it to people. I could not say that word. I'd say, well, it's hot there. There's palm trees, but I couldn't remember the name of that blasted word. Or San Diego. There's a beach, it's an hour and a half from this beach place, kind of by Los Angeles. But it's kind of interesting how those oddball words that are not in common use are really seem to be my difficulty to remember.
Yeah, and again, you're not alone in that too. Honestly, that's why I more so recommend things like compensatory strategies like PAL over semantic feature analysis, just because it's really hard to pinpoint exactly what words you're going to have difficulty with, whereas compensatory strategies you can use on any word, just like you did. Like it's hot there, it has palm trees, it's near X, Y, and Z. Of course, it's going to be somewhat frustrating and feel inefficient, but at least you're more likely to get that message across, because you all of a sudden realize that you need to, work on the word San Diego or Palm Springs, so, yeah.
I don't need to work on the, I'll just say, well, I can't remember what it's near, but I know it's hot there.
Yeah, and it's important to also know when to like not stress too long on one, concept. Like, is it most important that they know in general what area you're talking about? Or is it, like, of course you want them to know specifically exactly what you're talking about, but you also don't want to get very frustrated and like be able to move on with the conversation when you can. So that's another thing to keep in mind.
Okay, thanks.
Karen, another thing I just wanted to bring up is the fact that you're talking also about proper nouns, which takes its place in the brain in a little bit of a different way than, let's say, common nouns. I don't know if people started to notice this, but I know that in general, the idea is that with proper nouns, that seems to get harder to recall and retrieve starting in our 30s, even if there isn't a pathology there. And part of the reason for that is, if you think about the name of a person, for example, somebody you just met, it's a very singular, unusual piece of information that's not necessarily attached to a lot of other semantic information that helps you access it, right? So if I think about Karen and I met her in this one instance, if I switch to another environment, I think, oh my gosh, what is her name? It's because I only have this one experience with Karen. And so if I met Karen again in another setting and I started to learn more information about where you are, she lives in Seattle, et cetera, then Karen is going to be a lot easier for me to access later on. So proper nouns, names of places like Palm Springs, again, it's somewhat unusual, and it can be, it can trip us up again in the normal circumstances, let alone when you have something going on in the brain that's also affecting your language retrieval. So just something to keep in mind about that.
That's helpful. Thanks.
And another thing, again, to keep in mind about proper nouns is, like, for instance, a lot of times people have difficulty remembering names of like people. And so one simple strategy we use is like a characteristic about that person that starts with the same sound. So, like, I don't know.
Cute Karen.
Yeah, cute Karen, for instance. And that will help you for some reason, like get at that, more likely to get at that name. Thank you, Bonnie, for the example.
Sure. I just wanted to bring up a question that was brought up in the chat privately, and I think what might be interesting for others to hear is a question about neuroplasticity and how does that play into language issues and therapies, and whether or not there's a role for cognitive rehab or doing any kind of brain stimulation activities to stimulate the plasticity and help with language. Megan, I don't know if you're able to address that at all. I certainly, have heard some studies, and certainly we're involved in our lab in certain types of actual brain stimulation activities, non-invasive brain stimulation through transcranial magnetic stimulation, current stimulation, et cetera. But I don't know if you want to speak a little bit to this question.
Yeah, I mean, we've done, like Bonnie said, a little bit with TMS or transcranial magnetic stimulation in regards to, if you stimulate certain language areas of the brain, if, that would be helpful. And we're honestly, we're not sure yet, but what we have found so far is that it can help a little bit in the short term, but we haven't found any evidence that it could help with the long term, not meaning like it's not helpful, but just to keep that in mind if you want to be part of a study such as that, or there's no harmful effects that we have found at all, but we have found that it's been helpful with certain areas of language for a short period of time.
It's interesting. Have you ever taken any person with aphasia into the MRI or into a PET scan to see if they're thinking in their head and they just can't say it? You know what I mean?
Yeah, we definitely do a lot in our lab with structural MRIs or functional MRIs. So in functional MRIs, they are doing, for instance, a certain language task, reading words, maybe trying to come up with words. And we also have PET scans that we do as well, just to see how the brain works and, what areas of the brain are most important and different things like that. But unfortunately, I wasn't involved in the specifics of the functional MRIs doing the language tasks, but maybe Bonnie has more to add to that.
Not really. I think you've kind of covered it all in terms of, the studies that I know of that look at functioning are really in patients who don't have degenerative conditions. So when it's not something that progresses, the problem, and going back to the previous question about neuroplasticity, is that a lot of times people think, is it just about exercising those connections, and can we actually watch that and see that as they're going through therapy? The difficulty becomes when there are no more connections to actually stimulate. Right. So when there's a degenerative condition, you're losing the cells, you're losing the cell connections, in which case it might be a little bit harder to use the use it or lose it principle here, where you're just exercising and trying to build some sort of almost like a muscle. It doesn't quite work. And I know that there are some studies that have looked at this and whether or not that kind of connectivity is still available essentially as the disease progresses.
Interesting.
Yeah,
Elka,
and
you had a,
oh,
go
sorry.
ahead, Bonnie. Go ahead, Megan.
I was just going to say, related to that, is that we always recommend that people stay as social as they can, not kind of like if you're having word finding difficulty, let's say, to not avoid social situations as much as you can, because I think remaining social and around people that you feel comfortable with is helpful. However, things like testing people and like seeing if you can name that word this many times or in this situation, we don't really recommend that because we don't think that that is helpful in remembering the word later.
Thank you. Elka, you had a
Yes,
question.
I do. It's about Peter has PPA logopenic type, and we were wondering if he's already far gone so far that the therapy is not going to do anything for him, because right now we have a sense that the lady said she has experience with PPA, but it doesn't seem that there is any structure in those sessions. They have sort of attempted conversation, but he's not given any tools for, there's no sense of that she knows compensatory techniques. She said, just describe the situation, describe the words, and if he doesn't have a word, he lost most of his nouns and geographic locations, including where were you born. So he would like to regain those. We made like around 60 cards. On one side is question, I was born in, the other side is the response. And he's doing them on his own at home. But some of them, they're like, can't get it. It's like, no matter what, they're not happening. But we were thinking, what's the more how to bring that into the therapy? The woman doesn't seem to be, okay, good, you do it. But doesn't seem this is reactive. So we reached the point that we think we need to look for somebody else who actually has more, or he's just so gone that she just says, it's good to engage language. So what it boils down to is having a attempted conversation without structure in it. And we just don't know if it's a way. It's never a waste of time because he's engaging. But we would like to get effects. So most of it is a homework at home based on what we figure out would look good, will work with those handmade cards. He's getting the cards, then he's throwing them because there's so many of them. We were trying to find, is there a software or something that would help us to contain them, that he could use them? And we're not getting any advice from her. And it's gotten frustrated. Is this that she might not be trained in compensatory techniques? What's your feel for it? I know it's hard to criticize a fellow practitioner. It's not really critique. It's about we're not trained in everything. It's just kind of
right. I mean, it might be as simple as that it's not a good fit, like even let's say like a psychiatrist or, a therapist, like you have to have the right connection with them. And it's true for really any health professional. And it seems like if, like, for instance, if I was treating your loved one, I wouldn't necessarily have so many cards and I wouldn't focus on regaining those words necessarily, because it sounds like he may be at a severity that is beyond mild or maybe the moderate to severe stage. So I think that will, like, trying to relearn words on cards, especially if there are a lot of them, may just increase frustration and not actually be very effective. And if he or she, the clinician, is not, isn't very structured or teaching compensatory strategies, it may make sense to try someone else. And even if your overall feeling is that it's not very helpful, I don't think there's really any harm in, trying a different clinician.
So what would you do instead? Because yes, indeed, he gets frustrated. Some words are successful. He can beg, reuse them. So that aspect makes us believe, okay, it's worth to do. But,
I think it's more about trying to get him in the habit of talking around the words that he's having difficulty retrieving. And then you trying to, have more yes, no questions, having the options be limited. Like, do you want this or do you want this? Are you feeling sad? Are you feeling happy? So him talking around words and you kind of promoting him talking around words. Like if he can't think of a word, you could be like, what does it look like? Can you point to it? Can you tell me where it's located? What does it do? So because he might be able to communicate better if he's talking around the words and you're helping him than him, for instance, look at flashcards and it may or may not be helpful in him remembering the word.
Yeah, the flashcards don't work in the communication. Yeah.
Yeah.
That's terrific. Thank you, Elka. Anybody else have one last question? Yes, go ahead, Aline.
Okay, it's not really a question. I just wanted to say that the context and making sounds helps. Like the other day, Rick was talking about, he couldn't find, even though it was right there, and that's part of PCA, he couldn't see the toothbrush. And it was right on the counter. And he just, when I can't, zzz. So he makes noises like that. And then I go, oh, okay, razor, toothbrush. Then it's like, oh, toothbrush. Zzz. So I think even making noises that sound like it has been very helpful for us. So just wanted to
that's a great point. Gestures, pointing, noises, any of that's helpful. And, talking around a word. And I just want to say that I got one other question on the chat that's, about if I recommend hearing evaluations and is it important to get, make sure the hearing is okay. And definitely, especially if there's any question of comprehension difficulty, a speech pathologist will always recommend a hearing evaluation to rule that out. Because, it might be as simple as the hearing may need to be fixed. So yes, we often recommend hearing evaluations when comprehension is a factor.
Any other questions before we call it an hour?
I just received one quick one. Megan, would you be able to talk a little bit about the efficacy of constant therapy?
Oh yeah, I used to work for constant therapy. So that's, I recommend constant therapy. It's good for, it has language exercises and cognitive exercises. I recommend it if you enjoy doing it. If you don't enjoy doing it and it's annoying or you get frustrated doing it, it's probably not worth it. However, if it's something that you enjoy challenging yourself, you enjoy doing the exercises, a lot of them are like games that I find enjoyable. There's definitely no harm in doing it. And, it's keeping your brain active, but my number one rule is try to keep your brain active in activities that you enjoy. So, if it's a hobby and like playing cards or something, and you enjoy it, that can activate your brain, just like constant therapy can if you enjoy it.
Can you just say what constant therapy is? Since
Oh yeah, sorry. It's an application like on an iPad, for instance, and it basically gives you homework. It can be language exercises or cognitive exercises, and it evaluates you in the beginning and then moves you up on levels or like different tasks depending on where your difficulties are. And you can have a clinician change the task, or you can have the actual app change the automatically change the task for you.
Oh, interesting. Thank you. Well, thank you so much. This was amazing. And what I'm going to do is I'm just going to make this available to our PCA support group, not the Facebook site, but I think that a lot of people in our group have, would really benefit from it. So thank you. Thank you
Of
for
course. Thanks for
being
having
with us. Bonnie, thank you. And if anybody wants it on YouTube, and doesn't mind your pictures being shown, you let me know. If you do mind letting your pictures be known, then I will not put it up on YouTube. So, okay. Thank you, Bonnie.
Thank you, everyone.
Thank you all.
Thank you.
Thanks.